Hello and welcome to page 78 of Anatomy Coloring Book. This is Dr. Stephen Harkins. In this lesson we're going to learn about the ascending tracts, pathways, leading from the spinal cord down here, to the brain. Ascending, of course, means upward. We're going to be talking about receiving signals, sensory signals. Sensory signals, in other words, sensation. For example, a pinprick, pressure, touch, and the sensation of position, muscle stretch, and muscle position. How do these sensations go from, say, your finger, your skin, your muscles, to your brain, so that your brain can perceive what is going on? Let's first talk about pain and temperature. Let's say you touch the point of a pinprick. Let's follow the path of that pinprick. Of course, we know that neurons, we've talked about these, there are neurons and receptors in your skin. And they travel along, the signal travels along a neuron. This is the cell body. Along the axon. And what will happen, it will travel into the spinal cord, into the posterior horn of the spinal cord, right? Responsible for sensory. And this is an afferent neuron going from the periphery of the body into the spinal cord and brain. Then there will be a synapse in the posterior horn. Oops. A synapse in the posterior horn of the spinal cord. Then this we call a first order neuron. This one right here. After the synapse, it's called a second order neuron. And the second order neuron crosses the spinal cord from the right side to the left side, and then begins to ascend upward toward the brain for perception. When it crosses over, when the neuron crosses over, there's a specific word for that. It's called decussation. And over on the right here, I'm going to underline it. It crosses, it decussates to the opposite side, to the contralateral side. Contra means opposite, lateral means side. And these are sensory afferent neurons. And let's take a closer look at that down here at the bottom. Here is your sensory neuron right here, receiving input from this pinprick right here. Sensory neuron. And the cell body here, and here it is, the sensory neuron receiving the pain from the pinprick, the signal, the electrical signal. Synapsing here in the posterior horn, then decussating to the other side, to the contralateral side, and then rising in a specific tract. We're talking about tracts and pathways here, aren't we? Look, in which pathway? It's called the lateral spinothalamic tract. So the signal comes into the spinal cord and synapses and then begins to rise and goes upward. Where do you think this signal is going to end up? It's the spinothalamic tract. So it's going to wind up at the thalamus. So let's follow it. Here's the signal, the electrical signal, and this is the first order neuron here. And in the second order neuron, after the synapse in the posterior horn, decussates over and rises, ascends through the spinothalamic tract of the spinal cord to the, there it is, the thalamus. Remember this area here? The thalamus. Now it's going to synapse in the thalamus with another neuron. Well, what order neuron do you think this is going to be called? Of course, it's a third order neuron. Now, after the synapse in the thalamus, the third order neuron travels through the, remember what this is called? The corona radiata. The corona radiata, however you want to say it. Also known as the thalamocortical tract. Why would it be called thalamocortical? Because it goes from the thalamus to the cerebral cortex. So here it is. Here's the third order neuron. Going from the thalamus, traveling the synapse, the signal on the axon of this third order neuron, traveling through the corona radiata, the thalamocortical tract, to the post-central gyrus. Do you remember the post-central gyrus? Up here. The post-central gyrus of the cerebral cortex. This is known as the sensory cortex, obviously because it receives sensation. Now we're putting it all together, aren't we? In all the previous lessons, we've learned some pretty confusing things and wondered why we had to learn about the thalamus or the posterior horn of the spinal cord or the postcentral gyrus or the corona radiata. Now it's all coming together. Over here to the left, the thalamus we talked about. Talked about the thalamocortical tract right here. And the sensory cortex of the postcentral gyrus. Postcentral gyrus of the sensory cortex. So we've talked about pain and temperature. What about touch and pressure? How does the nervous system interpret and receive messages for touch and pressure? Let's say you squeeze your two fingers together here. Well, there's a sensory receptor in your skin that senses, sensory neuron, with a receptor on it that senses pressure and touch. And that neuron, that receptor becomes activated here. And of course, here's the cell body of the neuron. And that signal is sent along from the receptor, this axon, into where? Well, it's a sensory neuron. All sensation, all input, afferent input comes through the dorsal horn of the gray matter of the spinal cord. It passes through here, the dorsal horn, and then begins to ascend or go upward toward the brain so the brain can interpret this sensation. Touch and pressure sensation is a little bit different. Recall that with pain and temperature, there was a synapse in the posterior horn. Well, touch and pressure is going to behave a little differently, the neurons. Looking down here. Neurons will pass through the posterior horn and into what's a section called the posterior column, and will rise through the posterior column. This is a first order neuron. And it's still a first order neuron as it rises through what's called the posterior column of the spinal cord. And will synapse not down here in the posterior horn, but up here in the medulla. You recall the medulla oblongata. So in the medulla, here you go. Now, this is where a synapse will occur, and here's the cell body of a second order neuron in the medulla oblongata, in the brainstem. Now, after that, the second order neuron does something, and recall that the pain neurons came up and stayed on the same side while they crossed over in the spinal cord and then went up. Watch what happens to the touch and pressure neurons. The second order neuron sort of sweeps across to the other side, from the right side to the left side, to the thalamus again, the thalamus, and then synapses with a third order neuron. This was the second order neuron. A third order neuron, and travels again to the cerebral cortex, to the postcentral gyrus, to the sensory area of the postcentral gyrus of the cerebrum, cerebral cortex. So touch and pressure, you can see, takes a slightly different path from pain and temperature. But the idea is that they're going upward, ascending toward the brain. Sensation. Of course, we know these are called the, and remember, this is called the thalamo, from the thalamus to the cortex, the thalamocortical tract. Of course, you know the sensory cortex side here. When the third order or the second order neuron here sweeps across to the other side of the nervous system, from the right to the left side. And I know that seems weird. We're just looking at it from a different angle here. Yeah, they're called, and obviously it'll happen the other way too, if the finger or the pressure came from these fingers over here on the left side. So they're called, when they bundle up like this and they bundle and cross over, they're called the internal arcuate fibers. Arcuate means like a sweeping or a sweeping line, or like a bow, like you would see on a bow and arrow, sort of a bow shaping. So you get a sort of a bow shaping crisscrossing happening here. And this area, the bundle, is called the medial meniscus. So these are internal arcuate fibers. When they decussate, they cross as internal arcuate fibers, and there's a bundle, they create a bundle called the medial lemniscus. And lastly, how does your brain know and perceive where you are in space? Position sense. If you close your eyes and bend your elbow, how does your brain know that it's bent? Well, that's because there are stretch receptors and position sense receptors in your muscles. There is a stretch receptor called the muscle spindle, and it knows how much stretch or lack of stretch exists in your muscles. And there are in your joints receptors, neuron receptors, that can tell what angle your elbow is at. For example, even when you close your eyes, you can close your eyes and bend your arm and know and take a guess at what angle your elbow is at even without seeing it. That's because there are receptors in there sending a message to your brain, and we're going to follow that path right now. There are sensory neurons, as we have been discussing. Let's follow the path of the sensory neuron. The sensation of muscle stretch and position sense travels to the brain in two separate pathways. Firstly, from the muscle spindle. Notice this dancer is balancing, and she closes her eyes, she's still able to balance. And all this information coming from her feet and the ground and in her joints and muscles is all going to the brain through this pathway. So you see the neuron coming in, an afferent sensory neuron. Here's the cell body. And this is the first order neuron, of course. And it synapses naturally in the posterior horn of the spinal cord and begins to rise through the, guess what it's called? The posterior spinocerebellar tract. Spino from the spine to the, guess where this one's going? To the cerebellum. The posterior spinocerebellar tract, you can see through the medulla and the brainstem here, then takes a turn into the cerebellum, the cortex of the cerebellum. Previously, we talked about cerebellum being the area responsible for balance and position. Here you go, down at the bottom right here. Body position, muscle tension, muscle overuse, and movement. So it's all coming together now. Now the second pathway is whereby the impulses will come in through the neuron and synapse again in the dorsal or posterior horn, dorsal horn of the spinal cord. Although it's not really, there's not enough space here to show two synapses there. And the second order neuron will cross over to the other side. And you can imagine this is genius. Sensation from, say, the right arm or the right leg is crossing over to the other side of the brain of the spinal cord, decussating and rising up to the opposite cerebellum, cerebellar cortex. So imagine how genius this is, that sensation of position and stretch would come from, say, the right leg, the right ankle, come up through two paths so that both cerebella interpret that data. This would be a brilliant strategy for balance, for both sides of this brain, the cerebellum, to be interpreting information from one side of the body. I imagine that is crucial to integrating the information for balance. And here we see it. The information coming in, cell body of the axon of the neuron here. The first order neuron synapsing with the second order neuron and heading up. And information, cell body, synapsing, first order with the second order neuron, crossing over and rising or global position sense. And all the while, the cerebellum integrating this information from both sides. And also taking information, by the way, from the left side, going up the other side and crossing over all at the same time. It's just magical. All the things that are happening in the body that we, at the same time, that we don't know. Anyway, this is Dr. Stephen Harkins. And this completes our lesson, page 78 of Anatomy Coloring Book, on the ascending tracts and pathways of the central nervous system.